All right. Welcome, everyone. This is one of the most exciting panels that you might hear actually in this day because we actually have very diverse background that's sitting in this panel, translating, starting from what Irina science from 2005, 20 years ago, into NFL player like Roschon, doctor like Dr. Jeffrey Gladden, and researchers like Matt and me. So it's a very diverse background of the researchers that's telling you about how do we translate actual breakthrough science into real life that every single one of you who is sitting here, and including Roschon as the player professionally, can be using the technologies of longevity. So now let's get started. Well, first of all, we're going to introduce ourselves one sentence very shortly. My name is Alina, one of the co-founder and CEO of Generation Lab, where we do longevity research translation, have developed the most accurate biological age analysis, and most importantly, the first longevity therapeutics that's now already in human body.
Matt Kaeberlein. I've spent about 30 years studying the biology of aging, first as an academic for most of that time, and then for about the last 4 years running a healthcare technology company, attempting to take what we've learned in the laboratory and bring it into the real world.
Hi, I'm Dr. Jeffrey Gladden. My background is 25 years of interventional cardiology. When I got sick and was told I was just getting older, it took me 2.5 years to figure out that I could change that. I left cardiology in 2012, and ever since then I've been building Gladden Longevity, involved with many aging-related therapies, diagnostics, AI, many things that are bringing to the market.
Hello, everybody. My name is Roschon Johnson. I'm a small kid from Southeast Texas. Went to the University of Texas in 2019. Was there from 2019 to 2022. Graduated with a business management degree. And now I'm going to my 4th year with the Chicago Bears. Yes, sir.
Yes. Roschon is one of the top performer in the world. So today we're going to focus on how do we actually bridge the science of longevity into what people like you can actually use in daily life. So tell us about what does your typical workout and diet usually look like during the off season, in season, post game?
Gotcha. Yeah. So it's a lot that goes into what a workout regimen or what a week looks like for me. But this is the simplest way I can put it in terms of how an off-season week would look for me. So Mondays and Tuesdays, those are work days. Wednesdays, it's more so of a recovery day. Thursday, Friday, we're back working again. And then Saturday, it's more so of a really kind of just an anything day. Anything that I'm feeling, anything that I'm, feeling that I need to work on, I kind of do. But in terms of the specific days, so Monday would look like for me, it would be like a 6 a.m. wake up. I'll get breakfast around 6:30. From 7 to 9, that's when I get a lot of my fluids in, my hydration, in terms of, just pre-prep, I would say. Before the workout, I would have some type of body prep, so meaning some type of joint moves, some types of mobilizations and activations before my workout. Typically, I work out between, I would say from 9:30 to 1 o'clock. And that's not just straight working out, that's lifting, some form of, drill work, catered to my position for that day, and as well as on the field running. So change of direction, sprints, different things of that nature. So 6:30 wake up, 6 o'clock wake up, 6:30 breakfast, 7 to 9 body prep, and breakfast, 9 to 1 training, at about 1:30, from 1:30 to about 2:30. That's really recovery, rest and recovery, whatever I feel like I may need for that day, whether it be needles, acupuncture, cupping, cold tubs, contrast therapy, things of that nature. And then from like 3 to about 5 p.m., that's complete rest. So off my feet, resting as much as I need to, and then later on in the evenings, I'll usually do some form of catching, drill work, just making sure I'm not, on my feet though. So just cerebral work, if that makes sense. Jug works on the machines, and then from about 7 p.m. on up until I go to sleep. I'm just kind of chilling. So that's kind of like a day, what the kind of gist of a full day looks for me. But like I said, the main structure of an off season is it'll be Monday, Tuesdays will be structured along the type of day that I just mentioned. Wednesday is more so just a lift and mobility recovery day. And then Thursday, Friday, we're back working again. And then Saturday is kind of whatever I kind of feel like I need to touch on. Sunday is completely rest though.
That's a full-time job
Yeah,
to
it's a
exercise
lot.
and rest.
It's hard to put it in the scope exactly like what I do, but yeah, that's kind of like the general structure of it.
Yeah, but definitely elite athletes are the OGs of longevity optimizers. You guys are full-time on this. Matt, does anything Roschon is doing right now is resonating with what you're doing at OptiSpend?
So I have to be careful. I don't want to say anything that's going to make Roschon come over here and tackle me.
No.
Yeah, I mean, actually, you alluded to this. I think, there's clearly an overlap between performance optimization, particularly physical performance optimization, and health optimization. But what I would say is they don't fully overlap. And so I think, Roschon obviously exercises regularly, pays attention to his diet, focuses on recovery and sleep. Those are three of the pillars of health span that I think those of us who are in this space, really think about in terms of lifestyle. The other, in my view, being connection. So that includes both sort of mindfulness, stress management, and human relationships, which I'm sure you have lots of friends. So I'm sure you've got that dialed in too. But I think that's a part where sometimes if you get too much into the performance optimization space, you can actually become suboptimal for stress management and focusing on personal relationships because you're spending all your time trying to focus on performance. So I think there's an overlap. One of the things that I'm sure we'll talk about is like, how do you assess whether or not you are really being successful at optimizing for physical performance, NFL football, or for longevity? And I think this gets into, we need biomarkers so we can really both assess where you're at now. Are you on the right trajectory as an individual? So that's the other piece. Not everybody in this room can do what Roschon does. And so there is a very personal component to this when it comes to trying to get yourself into the best position for a long and healthy life. Yeah,
totally. Dr. Gladden, you're practitioners who is seeing so many different athletes, celebrities, people. This is our daily life job. What would you suggest, Roschon, to add to his daily life to preserve longevity?
Yeah, I think that's a great question. I think for me, it's the question of what's the construct? What's the overarching construct? In the world in which I work, we've developed a construct, and it consists of 5 different circles. And the first one is life energy, and it's the circle that binds the other 4 in a Venn diagram. Life energy is kind of the psycho-spiritual space. Let's say that purpose, meaning, connection. It also ties in directly with stress. Okay, so we'll come back to that. The next one is longevity itself, which are the hallmarks of aging, things that are going to convoy and others are working on, we're working on. Then there's health, right? Something that you're, as an athlete, are sacrificing in ways in which you push yourself. In the games that you play, there's a detriment to each recovery and rebuilding. Then beyond that, there's performance. So the 4th circle is performance. So how do you actually stay fast, agile, strong, quick, balanced, great cardiovascular capacity, reserve, flexibility, and mobility? How do we do that at age 100? Particularly, how do you do that not only today, but how do you tee yourself up to be able to do that at age 100? And then the last one is the environments we reside in. Right, which has to do with, homework, business, travel, and vacation. How do we architect each of those to support the mission? So that's the construct in which we work. Inside that construct, what's really we found to be incredibly important is to deconstruct an individual across all 5 of those circles. When somebody is fully deconstructed, we can actually understand what are your genetic assets, what are your genetic liabilities, right? Where are you overstressing your system and understressing your system? we know that stress comes really in two forms, physical stress and emotional stress. And both of them take its toll. We know that rejuvenation therapies work much better in somebody that's parasympathetically dominant than someone that's sympathetic or stress dominant. So having the ability to go into a big game and remain calm. Right? A lot of times we feel like in performance we're trying to effort, right? The harder we try, the more aggressive we are. And yet in actual fact, I think that we actually perform our best when we're in a flow state, which is really kind of like meditation in motion. Right? Tom Brady's a good example of flow states. There are many of Joe Montana, many of these people, for yourself for that matter, when you know when you're in a flow state. And being able to cultivate that outside of the field, when you're in your training, becomes very important. So in your week that you described, one of the things that I think is really critical is to focus on how do I get my brain into that gamma flow state, right? It can be through meditation, it can be through different devices that can put you there, but how do you actually capture that? And I actually tell my clients that all of life comes down to one thing, and I'll tell it to you as well. All of life comes down to one thing, right? And everybody looks at me like, really? One thing, optimizing our nervous system. What we think, what we feel, what we believe to be true, how we go about things, all of it basically comes back to the nervous system. So in your case, one of the things that's really, really critical, and you're doing this, it's not when you're training, it's not about the muscles. It's really about the nervous system. You know that if you can be quick and agile and fast, that's your nervous system doing that, right? You're gifted with the musculature to support that. But training your nervous system, and as you're going through your workouts, thinking about how do I get into a flow state with my nervous system? That's where I'm going to be most efficient, most fast. That's where if I do get hit, I'm going to feel the least pain. I'm going to recoil from it in the healthiest way, right? When we're efforting all the time, we push into the wall, and then we get hurt. When we're in flow, we can flow with it. Right? So, who was the famous Chicago Bears running back? Walter Payton, right? Exactly, right? Very flowy. So when I think about ultimate longevity for you as a player, I think about you optimizing your nervous system to be able to be in flow, also to be able to recover. When you're recovering, you want to go into a theta state. This is a deep meditative state just before you would go into sleep. And being able to go into that state allows the body to rejuvenate. So the time that you spend rejuvenating, in the cold plunge, in the sauna, in the massage or the acupuncture, whatever, if you can put yourself into a theta state while you're doing that, you're getting a bigger regenerative benefit for the time that you're spending. Okay? So I think the nervous system is really key. Then there's many things related to the biology, which is, what are your hormone levels? We know that football players have a decrease in growth hormone production as they go through the game. We know they lose testosterone faster, things like that. So monitoring what is the impact that my workouts are having on me, that the games are having on me. Right? So I think if you can get that, follow your heart rate variability to see how stressed you are, how recovered you are. And the other thing that we found to be key in training is that it's really easy to overtrain. We think that, last week we bench pressed this, so this week we got to do that plus 5 pounds more, right? Really, the magic to longevity in performance, however, is adapting the workout to the state of the body in that day. So, for example, if you're wearing a Whoop or an Oura ring and you see your heart rate variability is low, right? You're familiar with heart rate variability, then you know that your body is stressed. It could be mental, it could be physical, but you're stressed, could be lack of sleep. That's a day to actually work out at a lower intensity, but again, work on the nervous system, right? Then when you come back and your heart rate variability is high, that's a day to go. It's a day to push hard. And ideally what you're doing in your game prep weeks is you're actually modulating your nervous system to have a high heart rate variability on game day. and your nervous system is ready to go, and you go out and play in a flow state, that's how you actually end up having your longest career and actually even making your biggest contribution for the Bears. That's how I would see it.
All right, that's a free consultation for everyone right there. Very helpful. We do actually see a lot of athletes as well, and also for founders who is having high stress, like less sleep every day. Guess how much are they aging faster compared to normal people? Numbers? 1.5 times. Great. It's 1.5x to 2x faster. So whoever is having high stress environments, lifestyle, exercise, usually what we see is as like executives, founders, or athletes, they're having these type of aging acceleration that's happening way faster than normal people. And that's why a lot of them are actually the ones getting disease way earlier than the normal people does too. So very important for us to moving to the next topic, which is what can we do? And especially for NFL, Roschon, like the ultimate longevity league, staying in peak shape for more than 2 years versus 6 means another contract that you're going to get. It's important for you guys, and it's having immediate output for that. What is some secret treatments that you guys are doing to stay healthy?
Yeah, well,
Can't
I
talk
mean,
about it.
yeah, well,
Not allowed to say.
yeah. I mean, honestly, there's a lot of smart guys in the league. I mean, we got a lot of vets that I've learned from that are in our locker room that are doing a lot of different things. Obviously, the NFL mitigates what we can and can't do at a high level and make sure that we're, doing what's best for us in the long term. But a lot of the things that I see guys now doing is centered around stem cells, PRP, PRP treatments, as well as hyperbaric oxygen chambers, red light therapy, like I said, contrasting, saunas, acupuncture. That's kind of like the main things I guess all the athletes would kind of gravitate towards. Also, I would say supplements are a big deal, really just in terms of mitigating inflammation and making sure our cognitive health is at an all-time high or as best as we can get it. Yeah, so it's really kind of centered around those things. There's really not anything super special or anything that's like over the top that I say guys are doing. Like I said, the NFL does a great job of mitigating, what we are taking, what we're doing, what we can't do. So, but yeah, I would say those things.
Yeah, fair. Matt, which are those are actually backed by science, which is hype versus placebo effect?
I think that's impossible to answer for many of these things because we just don't have great data on efficacy for stem cells and PRP and hyperbaric oxygen. So there's some evidence to support, and I have no doubt that those things benefit many people, but we really just don't have high quality clinical trials to tell us for sure what's the effect size, who's likely to benefit, how much is placebo effect. And I think the one thing probably everybody on this panel, even if we have different opinions about those types of therapies, can agree on is those are kind of the second or third level after you dial in the basics, which is nutrition and exercise and recovery and sleep. That's the foundation. And then on top of that, you can add things that could give some additional benefit, probably incremental compared to that foundation. But I think this is just a frustration in the field in general is we don't have the quality evidence for a lot of the, what I call the shiny object interventions that we would all love to have. So we're sort of left guessing.
Biomarkers too.
You can absolutely use biomarkers, although I think for many of the experimental therapies, many of which, are not approved, we don't really know which biomarkers to use to assess whether or not they're working for an individual. So we can see if things go wrong for sure, but we don't really know how to optimize those things.
Yeah, we'll use Irina's biological noise as the biomarker. And we have measured a lot of before and after for real life. So that's what we are seeing as the gap.
And I think one additional thing that's probably worth mentioning is I think when you get outside of the well-established things around lifestyle and select medications or supplements, I think it's important for everyone as an individual, whether you're trying to optimize your longevity or your performance on the field or both, to really try to do a rational risk reward analysis. In other words, how much is this likely to benefit me? What is the outcome if I get the benefit I'm looking for? What are the potential risks, and how could that derail my goals? And try to make the best decision you can.
Dr. Gladden, I know in your clinic, there's a lot of longevity protocols that you do for a different person. Could you cover some of that, and what would you recommend Roschon to do?
Yeah, I think it's a really good question. Roschon and I were talking a little bit in the lobby before about the use of potential stem cells was your question to me. And, what are the dangers? What are the risks? That kind of thing. What are the benefits? I think one of the real key things to understand is that any shiny object can really be a benefit. The problem is that there's no shiny object that works just by itself. It's really, biology is complex. It's not like, well, we have stem cells, so we're going to give you stem cells. We're going to put them in your shoulder. The way it really works is you've got to prepare the system. Think of it like a farmer. You've got to actually plow the ground, then you put the seeds in, then you fertilize it, then you water it. When you take a systems approach to it, you can get remarkable regenerative. We've seen it in our clinic. I've seen it in myself over and over again. So we know that these work, but they don't work in isolation. One of the problems that I see in medical research is that we isolate things down to a point where we want to see if this thing does that. But in actual fact, it actually works best when it's part of a system, not in isolation. So in the research world, being able to develop trials that can actually look at the system, I think would be a more functional approach. That being said, for you, what I think is important if you are going to get a procedure done is to understand why the injury happened in the first place, right? What part of the nervous system was out of balance, or you just got caught off guard, somebody hit you from an angle you couldn't see. But then how do you actually prepare the system? So what we do is, let's say somebody's going to have a regenerative procedure, and they would be maybe older than you were. We give them some senolytics, the prune senescent cells, right? We know that's going to dump trash into the system. Then we do total plasma exchange, where we take out the plasma and replace it with saline and albumin. There's good data on this. Alina alluded to this as well, diluting the inflammatory markers. So you might even do that a couple of times. Then after that, you can start to drop in stem cells, and there are different varieties. Mostly you want to be using your own stem cells. But then you can put those in. Those can be supported also with different supplements. We all talked about peptides. There's no data. Well, actually, there's tons of data on peptides. We have amazing experience with peptides. And getting the right combinations of peptides and avoiding the ones you shouldn't take, particularly not every peptide is the right peptide, right? And this is where people get it wrong. That's the problem with the gray market. People are buying peptides. They don't know what they're doing. You can accelerate risk for cancer. You can cause all kinds of problems. So I'm not an advocate of that. But if you actually select the proper peptides in conjunction with the proper therapies, you can get some dramatic results. We've even gone into cord blood and placental tissue factors. It's how I rebuilt my knee. And when you bring all that to bear, you can create and then put a parasympathetic nervous system, milieu around that. You can get remarkable results for people. I think the key thing is, what are the ways in which you're going to measure where you're at? So part of that's going to be performance. One of the interesting things for NFL, of course, is head trauma. And there's a new device out called NeuroCatch that we just ordered that we're getting into the clinic that basically has the ability in 5 minutes to do kind of an evoked potential on the brain. It's not an EEG, but it's evoked potentials. And it can tell you the status of your brain. So you could do this test prior to playing the game. You could do it after the game. What was the impact of the game on it, right? That was my head today. And based on real-time feedback, you can then, change your supplements, do this, take a rest. There are therapies that could be done. One of the things we found in medicine in general is that there's no better feedback than real-time feedback, right? You come in, you see your doctor, we'll see you in 3 months. Well, that's almost useless. Not useless, but almost. The beauty of a continuous glucose monitor is you can see, I just ate strawberries, what happened, right? So if you just play a game and you can see what happened, that would be very powerful for you. So anything that you can do to get real-time feedback on how you're doing, particularly your brain and nervous system, because that's drives a lot of the other issues, I think that'd be super important. So.
Yeah, it's interesting that since now we are working with more than 750 clinic, including your clinic, Dr. Gladden, that we are seeing in real life. There are some examples that people are doing tests before and after to capture all of these real clinical marker changes and what's happening to their body. Like for stem cell, as an example, we're seeing an average of 5.5 years of biological age reversal, specifically targeting cellular regeneration and brain regeneration and reproductive system too. For therapeutic plasma exchange, it's mainly targeting immune systems, age reversal for about 10.6 years in average. And that's in a case of 3 months or 3 different times of TPE. That's across in 3 months. But also for supplements and lifestyle changes within 14 weeks, which is about 3 months, we're seeing whole body rejuvenation of all 21 organ system age is able to be reversing back to a younger place. So there is things that we see that, of course, it's working, but case to case is really important, that you need to identify what's causing you aging right now, which part of our body is aging fastest, and then do a personalized intervention based on it.
Yeah, you want to be precise here, right? Because NAD may be an interesting supplement, but do you even need it? Right?
Yeah.
If you don't deconstruct the mitochondria to understand what's going on, you don't know where to push and where to pull. Like, do you need more B vitamins or do you need CoQ10? You don't know. So what we're big fans of is actually deconstructing people to actually understand, at least as best we can, where we think the leverage lies, so that we can ultimately create what we call the elegant solution.
Yeah.
As few inputs as possible to actually get people back into homeostasis.
Yep. Going back to Roschon, if you knew, we have discussed a lot about the latest technology of longevity, what's available, especially from Dr. Gladden. If you knew one of the organ in your body is aging faster than the rest, would that change how you train or recover?
Yeah, most definitely. I can attest to this because I'm one of the few players in the league right now that wears a Guardian cap in game. I've had 2 concussions in my career, and I kind of have catered my training around those concussions a little bit in order to mitigate, for one, the effects of it, and 2, just to be preventative. Yes, I was about to say, look, as soon as I had got my first concussion, I made sure to incorporate hyperbaric oxygen chambers into my recovery sessions, as well as incorporate omega-3s, vitamin Ds, and certain supplements for my cognitive brain health. And just incorporating things within my diet to make sure that I was supplying my brain with as much nutrients as it could possibly get. So I think that's one example of me catering, towards the injuries that I've, had in my career. But definitely, depending on, I guess, what each player kind of goes through, that definitely kind of caters how you train and just how you would go about it in general. And like you said, every athlete's different, everybody's different. So, obviously, I would think certain things would, be beneficial or not be beneficial to certain players. So, but yes, that's one example for me personally. After I had those concussions, incorporating the Guardian cap, I know the Q collar is one thing that's very, it's not exactly proven, I would say scientifically, but I think that's one thing that helps me as well. Yeah, so there's a lot of different things that I kind of incorporate into the, mitigate and be proactive from some of the injuries that I've had.
Matt, do you think will biological age be a routine health metrics, just like blood pressure and cholesterol, as the field is developing?
I don't know, to be honest with you, and I'm not really sure that it should be, because I think trying to boil everything down to one number is I get why people want to do that, sort of a gamification, but I'm not sure it's particularly productive when, as Dr. Gladden said, what we're really interested in is looking at this as a system of systems, right? So there's some problems with the biological age tests right now. they can't be applied clinically because we don't know precision or accuracy. So while I appreciate that some interventions seem to move the needle on biological age, it's not meaningful the way it's being done right now. So I don't think it's ready for prime time now, and I'm not really sure that that's a direction that we necessarily need to go. I think there are lots of biomarkers that are well established that we can use to assess where a person's at, what their sort of overall function is, and what we need to do to move them in the right direction.
What would need to happen in order for that to be a biomarker?
We need to know how accurate they are, and there are two components here. What's the precision of repeated measurements, and how close do you get to the true value?
Yeah.
They're very useful in the research world at the population level right now. So I think there's a lot of promise there, especially the organ specific measurements that we can assess. The problem is the way that they're being applied in the clinic, we don't have that statistical resolution to be able to assess precision or accuracy. And the epigenetic tests in particular are not actionable because we don't know what to do about a particular number that you get. So I think those are all challenges. They can be overcome. I think the tests will have value. Don't get me wrong. Epigenetic, proteomic, metabolomic, transcriptomic, microbiome, all will have value in the future. They're not ready to be applied right now. And I don't know that one number is where we want to go.
Yeah. We specifically published the peer-reviewed science journal on the cover of Aging, stating failed test of DNA methylation clocks, which is using the linear regression model, is not working, aka mathematical model cannot replicate how biology is working. So totally align on how one number of your biological age cannot represent how your body is aging, has to break down into organ by organ.
Yeah, I think Dylan's getting nervous over there about time. Okay.
We're good. We're good. I'm controlling
He
time.
keeps going.
Dr. Gladden,
Okay.
how will biomarkers and personalized longevity medicine change medicine over the next decade?
You're asking me?
Yeah.
I'll just say something about biological clocks. I think what Irina has done is spectacular, quite honestly. So congratulations. The entropy of aging, beautiful work. I also agree with Matt that you really can't reduce biological age to a single number. In fact, I think it's the greatest disservice that's almost ever been done in medicine, is for somebody to go out and get some blood work done and run it through an algorithm. And it's like, my biological age is 6 years younger than my chronological age, so I'm good. It's really such a disservice, because we are a mosaic of many biological ages: a heart age, a brain age, blood vessel age, liver age, et cetera, and we're only as young as our oldest age. So it's really important to deconstruct thoroughly and understand it. I think that's the 21 organs that you're looking at.
Mm-hmm.
I think when you think about, being able to impact epigenetic aging, methylation clocks, I think it's really interesting. We've seen our ability to do it already with certain interventions, right? TPE and things like that. You're doing it, and excited for the work you're doing there. What we want to see as well is that it actually has an impact on the measure of the organ system function itself, right? And so that's a step we're interested to look at as we work with these technologies. Because we have people where we do DNA methylation, and their immune system may come back looking 6 years younger than their chronological age, and yet we know they have cancer, and they have tremendous senescent cells in their T cell that they can't differentiate. So we know the immune system is struggling. So we're looking to see, how do we improve this and improve that simultaneously. Right? So I think that's part of it. I do think the future of medicine, quite honestly, is a dream that probably physicians have always had but never knew they had, which is to actually see the entire body as a system, right? So we're really moving into, with the age of AI, and this is what I'm working on in the AI company, the medical AI company, is to create a systems biology approach to medicine, where we can look at all the different components of those circles, the life energy circle, longevity, health, performance, environments, and weave that into almost a digital twin of the individual, and find out where's the elegant solution here? Where are the vulnerabilities? What do we need to protect you against? What are your assets? How do we leverage those in your favor? And then what interventions do you need? Which nootropics do you need for your brain? What's the best at decreasing neuroinflammation and helping you recover from a workout? So when we have a systems biology approach rather than just an organ system, see, medicine has suffered from dividing the body up into all these different organs and suborgans. It doesn't work that way. It's a big system. And the nervous system overrides a lot of it, right? So that's why the placebo effect actually works. So when you look at that, if you can get to a systems biology approach, I think this is really going to change the world.
Yeah. Can I just add in to make a plug? I don't know if he's here yet, but Lee Hood, who sort of pioneered this idea and now is working on it with Phenome Health, is actually giving a talk at this meeting. So make sure you catch that. Lee's fantastic.
Yes. So closing up, what we are seeing is translation from research world into clinical world and into people like Roschon that's able to actually benefit from longevity technology. And performance gets you through today. Longevity will thrive for decades for you. And that's it for our panel today.